Menopause is not a disease. Menopause is a natural, normal life happening in a woman's life.
I'm Jill Angelo, host of the Genève podcast series for women's health in midlife. I speak with the most forward-thinking experts in the health and wellness industries. These experts are helping women 40 plus feel confident and in control of their health in the most vibrant years of their lives. So join us on this journey of women's health. Welcome to part 2 of my conversation with Dr. Jane Guiltinan, Dean of the School of Naturopathic Medicine at Bastyr University. In part 1, I asked Dr. Guiltinan to give us a 101 on naturopathic medicine. And today, we're going to hear the top questions naturopathic doctors are asked by women managing their health in midlife. If you missed part 1, check us out on our website at geneve.com. Welcome, Jane. When a woman comes to see you, walk me through what that first experience is like, and then how does it tee up the partnership in terms of working together from going forward?
All right. Well, it probably initially would look very much like walking into a conventional medical doctor's office space, waiting room, check in, fill out a bunch of paperwork, get your insurance card out, etc. Walking into the examination room would look very similar to a medical doctor's exam room with a chair and a table and, the typical medical equipment. And then we would begin our conversation. I think the difference there is that the interview would probably be much more in depth, or the history, and lengthy than it would be in a conventional medical doctor's office visit. Typically, I would see new patients for 60 minutes, for a full hour,
Wow.
and return patients for somewhere between 30 and 45 minutes. I think the typical conventional medical doctor's
10
visit
miness
is something like 10
to
or 15
15
minutes. So, and they, to their credit, they focus in on the chief complaint, and that's what they're going to focus on, and they're laser focused on it, and they'll address it. For me, it's not just about that chief complaint. It's about what we talked about earlier, which is, tell me more about this. Tell me how this impacts your life and your family's life and your coworkers' lives, if it does. And let's look at some of the underlying things that might be contributing to why your body's not able to, is blocked from this innate ability to be healthy. Once we have done that, I'll probably do a physical examination. Again, it would be very similar to what they would experience in a conventional medical doctor's office. If they need a pap smear, I'll do that. If they need a recommendation for a mammogram for breast cancer screening, I'll refer them for that. We'll order appropriate blood work if it's indicated and necessary. And then I'll probably send the patient home with actually a homework, which is if I haven't gotten a clear enough sense of what they eat and how they feel as they go about their day, I'll send them home with what I call a 5-day diet and symptom diary. And I'll ask them to write down everything that they've put in their mouth each day for 5 days, and how they're feeling and what they're doing. What was their exercise level? What were their emotions like? And what was the activity of the day? To see and then I'll have them bring that back, and we'll go over it together. Not only for the nutritional content of their diet, but also for, you see here where you had just a glass of orange juice for breakfast and you felt really crappy before lunch. This might be a blood sugar problem that's going on here, and I know how to help you do that. So we'll go over it together, education, doctor as teacher, and then we'll put together and we'll review the lab work if it comes back, review the pap smear results if they come back, and then we'll put together a plan. And I say we, because this is I'm a very strong believer in shared decision making, and that this is a partnership, and that the patient knows more than I do actually about who they are, how they're feeling, and what they're able to do. Because I might say, wow, you really need to make drastic changes in your lifestyle here if we're going to get anywhere. And she might say, I can't do that. And so then the partnership is, okay, well, what is possible to do? And then we'll look at it in, here's where we want to get to. Let's start in smaller steps. What's doable for you? Could you try to go to bed at 11 o'clock instead of 1 a.m.? and see if we can improve the quality and quantity of your sleep. Right there might make a huge difference. So we'll, in a partnership, agree on a treatment plan.
And it's really in her best interest to be honest and tell the truth, like truly writing down in that diary what she's consuming or if she can make a lifestyle change or not. I think that is one thing I picked up in what you just said. We tend to want to please versus truly know that there's more help in being honest with our partner physician or doctor.
Absolutely. Yeah. And some people are, they're nervous about it. They think somehow they'll be judged or criticized or found out. Little do they know, if they ask me those same questions, what they would find out about me. Yeah. So one of my jobs is to, again, establish a good trusting relationship, help the patient understand that it's important to talk, be real, be honest about this if you really want to make some changes in how you're feeling.
Okay, following on from our conversation on kind of naturopathic care 101 for women's health, let's get into more of the meaty stuff relative to menopause and some of the questions you get. So tell us, what do you hear most often from women coming in, especially in midlife and menopause? What are some of the questions or the issues that they bring to you?
One of the most common issues and questions is around hormone replacement therapy. And women have many questions, many concerns about hormone replacement therapy. And unfortunately, there's a lot of misinformation out there. So hormone replacement therapy is a very effective therapy for treating hot flashes in the menopausal transition. There's no question about that. It's also true that long-term hormone replacement therapy does have some risks, and so women it's important for them to be informed about those risks. They're small risks, but they're important risks, and those risks go up as the number of years on hormones goes up. And many women come to naturopaths because they've read information about bioidentical hormones, and the information they read tends to make them believe that these are somehow better and or safer than conventional hormone replacement, that they're natural and conventional hormone replacement is synthetic, and therefore the natural is better.
And I'm sorry to interrupt you, but what is the difference between the two?
Well, bioidentical hormones are hormones that have come from natural plant materials and are processed in laboratories to have similar properties to human estrogen and human progesterone. They look like human estrogen and progesterone, their molecular structure. That's why they're called bioidentical. Conventional hormones may come from natural substances. Many of them do. The most famous being Premarin, or conjugated equine estrogen. That comes from pregnant mare's urine, which is how it got its name, Premarin. However, it is not bioidentical because horse estrogen molecules are different than human estrogen molecules. So it's natural, but it's not bioidentical. And then there are also synthetic conventional hormone replacement agents, both estrogen and progesterone. So the two camps tend to debate with each other, I think, probably in order to sell their product, right?
Absolutely.
And the camp that says bioidenticals are better, it's because it's the same as human estrogen, and that way your body sees it more naturally and won't react badly to it, et cetera, et cetera. There's some logic to that. There actually is some logic to that. However, to date, we don't have the research studies to suggest that these hormones will be any safer when taken long-term than conventional hormone replacement therapy. So when a woman comes and asks me this question, I will say, certainly if we want to go the hormone route, because there are many non-hormonal routes you can try first, we could certainly start with bioidentical hormones because they're effective and may be safer. But until we know more, I think we have to recognize that they probably have the same risk profile as conventional hormones. And again, that risk profile is low, especially for women who start at a younger age, under the age of 60, and who go off them before they've been on them longer than 5 years. The risks start to go up at 5 years of use.
I was going to ask you, what is that time limit that is kind of quote unquote safe?
Well, the data we got from the Women's Health Initiative seemed to indicate that once you were on hormone replacement for more than 5 years, that's when some of the risks became more significant for breast cancer and things like that. So younger age at starting and going off them once you're at about the 5-year limit, probably very safe, either conventional or bioidentical.
And the risks are they most often always related to cancer, or does heart disease come in there at all?
There is some heart disease risk. There's question about whether there's a risk on brain health, dementia risk, whether it helps or hurts, we're not sure. We're clear that taking estrogen seems to reduce risk of colon cancer. And there may be some benefit in terms of bone density and then lower risk of osteoporosis or bone fractures as a woman gets older.
And so who is saying that the bioidentical hormones are safer?
Well, I probably shouldn't name these people, but there's a certain celebrity out there who's written a book called The Sexy Years, and I think several other books, Suzanne Summers, who has really promoted this.
Yeah.
And you know, in her defense, she is a breast cancer survivor and was going through severe menopausal symptoms as she recovered from the treatment for her breast cancer. And no one would give her hormone replacement therapy because of the worry of the breast cancer. And she found someone who gave her these bioidentical hormones. She was helped, which would be expected, and she's become a proponent of them, strong proponent of them now for a number of years. And you know, it's true, it helped her very much. But what I don't think we can say for certainty, because the studies have not been done, is that these hormones are really any safer on a population basis than conventional hormones.
So for women who don't want to or who can't take hormone treatment of any kind, bioidentical or the traditional, how do you approach that in terms of nutrition or other options?
Oh, that's so much fun. That's my special area, because I work to try to help women through the transition without hormones, because I think that's actually the safest way to go about it. And many things in the natural world, soy, if you're not allergic to it, probably has the highest concentration of phytoestrogens or plant estrogens of any food. So eating soy in mostly unprocessed ways, and fermented soy can actually it's very weak estrogen, but it does provide some estrogen activity, and women have seen some benefit from soy. Then there are a number of other foods, oats and clover and alfalfa and things like that you don't usually eat as food, but you can get in herbal medicines. So those would be the next level up, would be actually taking herbs and other supplements that have phytoestrogenic or plant estrogen activity. And again, very weak estrogen activity, but enough to impact the person. Black cohosh is probably one of the most studied herbs.
I hear that
menopause.
one all the time. Yeah, for hot flashes in particular.
Yes. I was involved in a study with a colleague from the University of Washington on it, and unfortunately that study didn't show beneficial effects, but I will tell you that from my experience, for some women, black cohosh is very effective. Maca is another one that you may have heard that's out there on the market. That's a Peruvian herb. I believe we use the root of that herb, and I have seen much benefit from maca in terms of not only hot flashes, but also libido. So one of the symptoms that I probably didn't mention in our prior conversation is decreased sex drive. And maca has been reported traditionally to improve that, and I believe that I've seen that in my practice. We need more studies. There aren't very many studies on it. So maca, black cohosh, are as I said, alfalfa. Those are some of the more common herbs that are used.
That's great. You know, it makes sense. I used to always feed my horse alfalfa, and no, I'm kidding. Sorry, I digress.
Probably had really good estrogen. in her urine.
She did. I didn't ask her if she ever had a hot flash, but I think she was okay. And sales of maca will probably skyrocket after this podcast airs with the libido thing. Relative to, just then when women come in and talk to you a little bit about, kind of the more natural ways of addressing, the symptoms that they're experiencing through herbal medicine, I can assume there's probably good herbal supplements and those that are less effective. Whether, some brands are more effective than others or more natural, or can you talk a little bit about that and what to look for?
That's a really important question because unlike prescription drugs, which are heavily regulated by the FDA and have to go through rigorous testing in order to be put on the market, that's not the case for nutritional supplements. There are now laws that the FDA is beginning to enforce to at least assure that the companies who produce these supplements do appropriate quality control on their supplement products, meaning testing each batch for appropriate quantity of what's in there, what they say on the label is actually in there, making sure there's no contaminants in there, and making sure that the claims they're making are actually backed up by quality control studies that they've done. So that enforcement is just beginning. There are still a number of supplements out there that probably don't pass muster. So I think what the informed consumer can do, first of all, is consult with a knowledgeable healthcare professional like a naturopath or someone else who knows about using nutritional supplements and can guide them to good quality companies. But you can also do your own research. You can ask those companies about their quality control programs and whether or not they're certified as having good manufacturing practices by the FDA, which will ensure that some of these things are done. And that sometimes is on their labels and sometimes it's not. If it's not on their labels, I would be wary, and I would, if you still want to choose that company, go to the company's website, contact them and ask them, what are your quality control standards? Do you comply with the FDA's good manufacturing practices? Do you test your batches and all of your batches for quality, et cetera? And, not always, but this is a rule of thumb. You get what you pay for. So don't think that the cheapest thing out there is really going to be beneficial to you, because there have been many tests done on some of these lower quality products, and they might say black cohosh is in there, and when the product is tested, there's actually no black cohosh in there at all.
Wow.
So you really do want to make sure you get a high quality supplement.
Yeah. So typically when women come to you and they're either just starting menopause symptoms or they're in perimenopause, or they're kind of, I don't know, in the middle of it, for lack of a better word, how long do you typically tend to see them? Because, studies have shown menopause can last anywhere from 4 to 10 years, and I know it varies for every woman. What's kind of that time frame that you typically see women for?
Well, that will vary again depending on when they came in to see me and where they are in that transition. If we're successful in establishing a treatment plan that's beneficial for them, once I've seen them maybe 2 or 3 times relatively soon, within maybe a month or two, if they're improving, I will spread out the time of follow-up, and eventually they don't need to see me anymore unless there's something else they want my help with. So typically I'll have someone first time and then return in 2 weeks, put them on the comprehensive program, see them in a month, because these things don't work overnight. And in a month, if they're doing well, I'll say, okay, well, let's keep going with this, and I'll see you in 3 months. And if they come back and they say, wow, my hot flashes are down to being negligible and they're not bothering me, we'll probably alter the treatment plan. I might back them off on whatever it is that we're doing a little bit if they're taking supplements or hormones. And then I might stretch it out to 6 months, and just come in earlier if you see a setback.
Mm-hmm. We talked a little bit about estrogen. How about progesterone and testosterone is kind of one I've started to hear a little bit more about. How do you address those, or how do you even, what are the indication that those are off or headed in the wrong direction?
Well, progesterone is an interesting hormone, and very early in the menopausal transition, when women are still having periods, that means that they're still making estrogen, but they may not be ovulating as regularly. which can cause all sorts of mood problems and heavy or irregular bleeding problems and discomfort for the patient. In that situation, because they're not ovulating regularly, when you don't ovulate, you don't make progesterone. So early in menopause, when they come in with symptoms, I will oftentimes try either herbal progesterone approaches or prescription progesterone without estrogen, because what's happening is there's estrogen being made, but not enough progesterone being made. So it's a relative progesterone deficiency. Once her period stops, and if you're going to give estrogen, and if she has a uterus, you must use progesterone, because estrogen can build up the lining of the uterus. Progesterone's job is to make that lining slough off. That's the cycle that we're going through in our menstrual cycle. If you only have estrogen action on that uterine lining and it builds up, and you don't have the progesterone to slough it off, that lining can build up to the point where it becomes abnormal, hyperplastic, and even cancerous. And you're at risk for uterine cancer if you are taking estrogen and have a uterus and you're not taking progesterone. So very important. If you're on estrogen and you have a uterus, you must take progesterone. The other hormone you referred to is testosterone, and women do make a small amount of testosterone, and sometimes it can decrease along with estrogen and progesterone when we go through menopause. I usually will test a woman for testosterone where I don't necessarily test them for estrogen and progesterone, and will only put them on testosterone if the hormone levels are low. It can help with libido, again, sex drive, and a few other things. It doesn't really help with hot flashes. And it can cause some women hair growth where they don't want it. Their voices can get lower, and you can get acne if you're taking too much testosterone. So I'm pretty cautious with testosterone.
Anything else that you want to address that I didn't cover?
Menopause is not a disease. Menopause is a natural, normal life happening in a woman's life, just like having a baby is. And we pathologized having babies a long time ago, and you've got to be in the hospital, and this is a disease that has to be managed by the medical system. It's not. That's also a normal, natural miracle event in a woman's life. But menopause is natural. Some women, up to 15%, sail through menopause without a symptom. You don't have to do anything about menopause if you don't feel bad. If you're fine with it and you're not having emotional issues with it and you're not having physical issues with it, enjoy it and celebrate it, and don't feel like you have to go to a doctor and take some sort of a medicine or do something because you're going through menopause. It's when those symptoms are out of control and causing you trouble like sleeping or emotional distress that's impacting your family life or job. That's when it's helpful to go seek help from a health professional.
I think that's the most uplifting response to menopause I have ever heard. So thank you so much.
You're welcome.
That's a perfect note to end on. So thanks again for taking us through what women, kind of how you address their needs in menopause specifically. And thanks again.
My pleasure. Thanks, Jill.
Tune in next week as I delve into the world of food and what nutritionist Julie Duffy refers to as food peace. Thanks for listening to the Geneve podcast series. We welcome your feedback at geneve.com. That's GENNEVE.com. You can follow us on Facebook and subscribe to us on iTunes or Stitcher, and you'll never miss an episode. The Geneve podcast series is produced by Shannon Perry. Theme music by Smitty. And until next time, watch the Geneve website for new stories and offers all dedicated to women's midlife health.